Today, let's talk about 5 reasons a baby may die in the womb. What is the difference between a miscarriage and a stillbirth? What causes miscarriages and stillbirths? What can you do in case your pregnancy has been terminated? Stay till the end, and we will tell you all you need to know. First, let us discuss what is a miscarriage and stillbirth. So a miscarriage in the United States refers to the loss of pregnancy before the 20th week of pregnancy. Research tells us that around 10 to 20% of pregnancies end up as miscarriages. A miscarriage usually happens because the development of the fetus is not as expected. It is generally the case that miscarriages occur before the 12th week of pregnancy. In case the pregnancy is lost after the 20th week, it is called a stillbirth. Sometimes the baby may die in the uterus just before the mother goes into labor or during labor. There are 3 types of stillbirths. An early stillbirth is when the fetus dies between 20 to 27 weeks, and a late stillbirth is when it happens between 28 to 36 weeks. In case the pregnancy is lost after the 37th week, it is called a term stillbirth. Even now, stillbirths happen. In the United States, 1 in 160 births is a stillbirth. Around 24,000 stillbirths are reported in a year. Now, let us talk about the 5 reasons why a baby may die in the womb. First of all, let's talk about genetic issues. So most miscarriages have been linked to issues relating to the presence of an extra chromosome or the lack of a chromosome. These issues may occur due to errors that happen when the embryo divides or when the embryo grows. It is not generally associated with genetic conditions from the parents. The issues with chromosomes may lead to a blighted ovum. A blighted ovum is said to occur when no embryo is formed. Genetic issues may also cause a molar pregnancy. In a molar pregnancy, both sets of chromosomes are from the father's side, which leads to abnormalities in placenta growth. Another similar condition is partial molar pregnancy. This is when the mother contributes 1 set of chromosomes, but there are already 2 sets of chromosomes from the father. Both a molar pregnancy and a partial molar pregnancy are not viable. Another similar issue is when intrauterine fetal demise takes place. This occurs when the embryo stops developing before there are any signs of pregnancy. The second reason that contributes towards miscarriages and stillbirths is lifestyle choices. Smoking, drinking alcohol, and use of narcotics and drugs have been shown to increase the chances of a failed pregnancy. The third reason is usually related to the mother's health. If the mother has uncontrolled diabetes, there is a high chance of miscarriage. In addition, if the mother is obese with a body mass index that is above 30, there is a good chance that it could lead to a stillbirth. Similarly, stillbirths happen in case the mother is malnourished. Experts also tell us that thyroid issues and hormonal imbalances are also contributing factors. Some women experience a condition called pre-eclampsia late in their pregnancies. It is basically high blood pressure and swelling. Conditions like lupus and clotting disorders also increase the chance of a stillbirth. The fourth reason relates to the mother's age and the number of fetuses in the womb. So the risk of miscarriage and stillbirth is higher among women who are 35 years and older. In addition, if a mother is having multiple births, like twins, triplets, etc., there is a risk of loss of pregnancy. The fifth reason for loss of a pregnancy can be issues with the placenta or umbilical cord. The fetus gets oxygen and nutrition through the placenta and umbilical cord. So any hindrances will cause abnormalities in the development of the fetus. There are a few more reasons that can lead to the termination of pregnancy. Infections can sometimes lead to a stillbirth. Bacteria like E. coli or chlamydia may have an adverse effect on the fetus. Similarly, rubella, herpes, Lyme disease, or malaria can cause issues. Sometimes a pregnancy is terminated when the mother has suffered a fall or she has been involved in an accident. Now that we have talked about the 5 reasons a baby may die in the womb, let us address some frequently asked questions that may come to your mind. In case you have any doubts or apprehensions, make sure you consult your doctor. How does a mother know if there is a loss of pregnancy? In case of a miscarriage, you may notice bleeding or vaginal spotting. However, in the first trimester, vaginal spotting or bleeding is common, and women with this symptom often go on to deliver their baby. So it's not a sure-shot sign. The bleeding may be accompanied by pain or cramps in the abdomen or lower back region. You may also find fluid or tissue that is being expelled by your vagina. Once your baby has become active in the womb, you may notice a sudden drop in the activity. The kicks or movements may reduce. It could be a sign that your baby has passed away. Usually, you'll notice that your baby isn't as active as it used to be. An ultrasound will confirm if the baby has passed. Will you lactate after a stillbirth? It is possible that even after a stillbirth, the mother may start to produce breast milk. At that stage, you can choose to allow the lactation to come to an end on its own, or take medicines containing dopamine agonists that stop the production of milk. Does the loss of pregnancy cause infertility? There is a popular misconception that the loss of pregnancy will lead to the mother being infertile, but there is no scientific basis for the idea. At present, experts tell us that the loss of pregnancy does not cause infertility. In fact, most women go on to have successful and normal pregnancies the next time around. However, keep in mind a few things. In case the loss of pregnancy was caused by a genetic disorder or umbilical cord issue, there is a chance that future pregnancies will also be affected by this. So, you should discuss this with your doctor. How do you find out the reason behind the loss of pregnancy? One thing that you have to keep in mind is that miscarriages and stillbirths sometimes happen due to unexplained reasons. It simply isn't possible to find out why it happened. In other cases, your doctor may be able to give you an assessment of the situation. Early on in your pregnancy, if you notice that you are passing fetal tissue from your vagina, then collect a sample and give it to your doctor for analysis. In the alternative, your doctor may prescribe a few tests that need to be carried out. A blood test is important to find out if you have any issues with diabetes, thyroid function, preeclampsia, or obstetric cholestasis. In addition, they may test for infections like chlamydia, herpes, etc. by taking samples of urine and blood. Your doctor may also examine the umbilical cord and placenta. Since these tissues provide essentials like oxygen, blood, and nutrients to the fetus, any abnormalities could have led to the termination of pregnancy. In addition, a test may be conducted on the umbilical cord to find out if there were genetic issues like Down's syndrome. In case you have delivered the baby, your doctor may direct that an autopsy be performed. This autopsy can also determine the reasons why the pregnancy was terminated. What happens if your baby passes away before you are in labor? In case your baby passes away before you are in labor, your doctor will perform induced labor, natural birth, or cesarean section. Experts usually recommend induced labor in case of a stillbirth. How can one cope with losing a baby? So you should first try and take some time for yourself so that you can heal physically and mentally. Don't get into a blame game regarding the termination of pregnancy. Trying to cast blame on yourself or your partner may make things worse. In addition, talk through this with the father also. It is often the case that the father will also be going through a difficult time. Both of you can help each other through this period. It is best to spend some time with your loved ones during this period and keep space for yourself so that you can grieve also. Some women have reported feeling depressed. It is completely normal. You can seek counseling or visit support groups in case you need additional help. How can you prevent a loss of pregnancy? The loss of pregnancy usually cannot be prevented, but the risk of this happening can be reduced. This involves understanding what pre-existing conditions both parents have. Then, the parents have to make changes to their lifestyle. Cutting down on smoking, alcohol, and drug use, and then eliminating them is the next step. In addition, it is recommended to reach a healthy weight before getting pregnant. You may either have to gain or lose weight in this process. After you get pregnant, go for routine tests like ultrasounds, blood pressure checks, blood tests, etc., so that you can monitor the progress. Further, routinely consult with your doctor and report any stomach pain or vaginal bleeding. Experts recommend that you do a daily kick count, then keep track of how your baby moves. In addition, experts state that it is better to sleep on your side rather than on the back. There are some foods that you should avoid to improve the chances of a normal pregnancy. Cheese that has a high content of fungus and molds. Raw or unpasteurized milk. In addition, avoid eating raw or partially cooked chicken and eggs. Avoid eating game meats. Fish like marlin, shark, and shellfish also should be avoided. Some experts also state that the consumption of caffeine and green tea should also be reduced. How long should you wait before getting pregnant again? So consult your doctor. Discuss this issue with them. Let your doctor advise you on when you will be ready. It is not just about physical readiness, but you have to be mentally and emotionally ready to get pregnant again. It is generally recommended to wait at least 6 months. And that's a wrap. We have talked about the 5 reasons why a baby may die in the womb. Have you experienced a loss of pregnancy? How did you cope with this experience? Let us know your thoughts in the comments.